The Ontario government is taking action to reduce wait times for some surgeries and procedures. Premier Doug Ford and the province's Minister of Health, Sylvia Jones, detailed their three-step plan earlier. It involves having more procedures take place in community surgical and diagnostic centres instead of hospitals. Step 1 focuses on cataract surgery. Step 2 on MRI and CT imaging, as well as other procedures. And Step 3 will be expanding surgeries for hip and knee replacements starting next year. Now, Ford says there are currently more than 200,000 people waiting for surgical procedures. And he made it clear Ontarians will continue paying for these procedures using their health cards, not their credit cards.
This is one step of making sure we provide care, no matter if it's cataracts, hip replacements, knee replacements, foot surgeries, diagnostics, and it takes the burden off the hospitals, that the hospitals will do the critical surgeries. This would be permanent, reason being we have an aging population, the baby boomers, old guys like myself eventually get up there and we need more care, and we have newcomers coming into Ontario to a tune of about 300,000 a year for the next 10 years. So we're going to be creative and take the best ideas from around the world, from around our own country. Look at BC, look at Alberta, look at Quebec. They're delivering it a little differently and they're being successful.
Now, that was Ontario Premier Doug Ford, and he stressed a few times in that news conference that the status quo is, quote, not acceptable. The CBC's Megan Fitzpatrick is in Toronto with more on what we learned.
Yeah, well, overall, they're really just expanding the surgeries and procedures that are done outside of hospitals. This already happens, but they're expanding how much it happens, Arthi, and what surgeries and procedures are done. So one of the things they're focusing on really is cataract surgeries. They say they're going to invest in new partnerships in a couple key areas of the province, including Ottawa, Kitchener-Waterloo, and the Windsor area, to do 14,000 more cataract surgeries a year. They say they're also investing $18 million in existing independent health facilities, in these clinics outside of hospitals that already exist, to do more MRIs and more CT scans, those diagnostic imaging tests, and more cataract surgeries, other minimally invasive gynecological surgeries, they say, and some plastic surgeries. Now, they also say they are allowing these centers to expand their scope beyond what they're already licensed to do more low-risk and minimally invasive surgeries. But we didn't exactly get a full list of what those might be, Arthi. But the government's saying that this will allow hospitals to focus on the more complex cases. And then one of the other key things we learned in that news conference is that they do intend to introduce legislation next month. They're not sitting right now in the legislature. They're due to come back in February. So the legislation will be introduced then that will even further expand the scope of these clinics to allow them to do hip and knee replacements. That's going to be a key change when that comes into effect. And again, overall, they say this is all about reducing wait times, clearing the backlog that built up during the pandemic, and helping people get quicker access to the healthcare that they need. They did emphasize throughout that news conference that these procedures will continue to be covered by OHIP, by the Ontario Health Insurance Plan. People will not be paying out of pocket, regardless of whether this is at a for-profit clinic, potentially. Some are nonprofit, but some are for-profit clinics that already exist.
The CBC's Megan Fitzpatrick in Toronto.